If I had one word to define IDELVION, it would be empowering. Being on IDELVION allows you to think about doing what it is you want to do, moving forward with what it is you want to do, and not think so much about hemophilia. I would tell a parent of a newly diagnosed patient there are advocates available. I happen to be one of them, and we are here to help you along this journey. My son was diagnosed with severe hemophilia at 4 years old. I wanted him to have a treatment that would allow him to grow up and be independent, to be able to do those things that he wanted to do with his friends and not have to worry as much about hemophilia. And with IDELVION and the extended half-life, he was able to enjoy himself and not always have to worry about whether or not he would be injured or have to pull away from the group in order to infuse. It was very important for me to create a new normal and allow him to do those things that he wanted to do as a kid. In the beginning, he was on an on-demand treatment, and we spent a lot of time in the emergency room. As he grew older and was able to take more control of his day-to-day and his treatment plans, he learned to infuse at about 7 years old. He was able to handle it on his own. In high school, he transitioned into a prophy treatment. With IDELVION, we could either do a 7 or a 14-day regimen, and his healthcare provider felt like the 14-day regimen was appropriate for him. My son chose the 1st and the 15th of each month. This made it very easy for him to maintain his infusion schedule. IDELVION's extended half-life meant that we could both worry less about his severe hemophilia. It also allowed him to not have to stick himself as much. We knew that the factor was working for him. Because of IDELVION's high trough levels, he was able to do more of the things that he wanted to do and not have to always worry about stopping to infuse or having to treat more frequently. Before IDELVION, he did have breakthrough bleeds. However, being on IDELVION and a 14-day regimen, breakthrough bleeds did not occur. IDELVION really helped to ease anxiety, and I knew as a parent that he had the proper factor levels in order to have the protection that he needed. I encourage anyone who is interested in using IDELVION, be informed and be able to have a constructive conversation with your healthcare provider. The most common side effects of IDELVION are headaches and dizziness. However, these are not the only side effects possible. My hopes and dreams for my son are that he will grow up to be an independent young man, not defined by hemophilia, encouraged, confident, and excited about what tomorrow will bring for him, his future, and his family. Being on IDELVION empowers the patient as well as the caregiver to be courageous and do more of the things that you want to do and not think so much about the diagnosis. I trusted IDELVION to protect my son so that he could live with fewer limits.
Important safety information. IDELVION, Coagulation Factor IX Recombinant Albumin Fusion Protein rFIX-FP, is used to control and prevent bleeding episodes in children and adults with hemophilia B. Your doctor might also give you IDELVION before surgical procedures. IDELVION can reduce the number of bleeding episodes when used regularly as prophylaxis. IDELVION is administered by intravenous injection into the bloodstream and can be self-administered or administered by a caregiver. Do not inject IDELVION without training and approval from your healthcare provider or hemophilia treatment center. Tell your healthcare provider of any medical condition you might have, including allergies and pregnancy, as well as all medications you are taking. Do not use IDELVION if you know you are allergic to any of its ingredients, including hamster proteins. Tell your doctor if you previously had an allergic reaction to any Factor IX product. Stop treatment and immediately contact your healthcare provider if you see signs of an allergic reaction, including a rash or hives, itching, tightness of chest or throat, difficulty breathing, lightheadedness, dizziness, nausea, or a decrease in blood pressure. Your body can make antibodies, called inhibitors, against Factor IX, which could stop IDELVION from working properly. You might need to be tested for inhibitors from time to time. IDELVION might also increase the risk of abnormal blood clots in your body, especially if you have risk factors. Call your healthcare provider if you have chest pain, difficulty breathing, or leg tenderness or swelling. The most common side effects of IDELVION are headache and dizziness. These are not the only side effects possible. Tell your healthcare provider about any side effect that you experience and contact provider immediately if bleeding does not stop after taking IDELVION. Please see full prescribing information for IDELVION, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.